am.
Okay.
1
Let's
minute.
go.
1 minute.
Let's go.
Okay. Hi. Welcome. We are back. We hope everyone's keeping safe during this COVID break. And we welcome all of you to our 4th web series that Dermapen World is hosting along with Dr. Andrew Christie, our clinical director. It's great to have all of you back. Our topic for today is going to be how to deliver safe and sterile aseptic, how to deliver sterile and safe aseptic procedures with Dermapen 4 ACM anti-containment management. It's great to have all of you back. Please feel free to ask questions alongside. Welcome, Andrew. Over to you.
Good morning, everyone, and welcome live to my lounge from Paris. It is in fact afternoon for you. Welcome back for those of you who have accompanied me on this Dermapen World journey for the last 4 sessions, including today. And for those of you who are new to this series, welcome to my lounge room. A big bonjour à Paris, and welcome to Live to Your Lounge series. So these are informal and casual mini webinars where we are going to explore, in conjunction with Dermapen World India, all things Dermapen 4, DP Dermaceuticals, tips and tricks, combination therapies, protocols, and skin indications. It is an absolute pleasure to be here. Now, we will be catching up, same bat time, same bat channel each week. And I look forward to catching up with you for our next round of series, which are going to be at 3 p.m., my apologies, local time. And this is going to be every single Tuesday. Do follow us on social media. We would love to see your support. So for Facebook, it's Dermapen World India. You can also get in contact with me. I'm Andrew R. Christie on Facebook. Otherwise, on Instagram, it's Dermapen_India. You can follow Dermapen World and also myself as Dr. Andrew R. Christie, all in one word, and we would be honored to hear from you. Any questions that you have through today, although you just see me on your screen, I can see a full team of moderators, a combination of key team members from Dermapen World India and Dermapen World. We've got representation from Australia, France, and India who are helping to moderate your experience and to also assist with the questions that you have so that we work on time and we keep the information relevant. Any questions which relate into today's material, I will be able to answer live. However, if there's any questions which relate into any previous sessions for this, if I can't tie it in for today's series, we will make contact with you directly, either from Dermapen World India or through Dermapen World International as well. We've just secured the next 3 weeks and we will keep you posted as lockdown continues on for the Indian market, but also for me here in France as well. So I'm very excited to be sharing today's topic, which is all about the Dermapen World ACM, which is Anti-Contamination Management System, and we're going to explore how to deliver the ultimate of safe, sterile, and effective procedures for patients. And I guess there's no time like the present to be focusing on hygiene, focusing on sterility, duty of care, but also lifting our standards so our patients see us as expert aesthetic practitioners with all sense of duty of care for both our colleagues, for our patients, but also for our businesses as well. Ever since the development of the first Dermapen by Dermapen World Australia in 2010, the company revolutionized microneedling by creating the ACM, or the Anti-Contamination Management System. And this is a collection that continues to grow each year of sterile products and consumables to now maintain quality and to now deliver the ultimate of treatment safety, but also pre and post-operative management as well. During this time period, why the ACM or anti-contamination management system is so crucial. Number one, it protects you as the expert practitioner, not only for your dermapen procedures, but for all aesthetic procedures. And you'll see the value of these products for your practice, for your clinic, particularly as some normality begins to resume using these products to protect yourself. Number two, of course, is about protecting your patient, delivering and offering predictable, safe, and effective procedures in a controlled, safe, and hygienic environment. Likewise, of course, this really then separates your business as being a leader in anti-contamination management. And this is an area that our patients are going to be looking for before deciding who's going to perform their procedures, where they're going to have their aesthetic procedures performed, and the safety and the efficacy of these procedures and the practitioner who is undertaking them at the clinic. This also, of course, links into branding. So as a Dermapen World Ambassador, as a Dermapen for user, we know globally, patients know globally that this is the pinnacle of safety. This delivers the pinnacle of efficacy, duty of care, and most importantly, first, do no harm. So we are now promoting the most hygienic procedures, particularly as we undergo the challenges of coronavirus, and our attention is very much focused on looking after ourselves and keeping ourselves safe and avoiding any risk of cross-contamination. So particularly during times of corona, there's a couple of essentials that I recommend and a couple of essentials that you probably want to show your patients. One of these is the DP Dermaceuticals CliniPrep. As opposed to an alcohol-based disinfectant, this is in a water base. It is a hypochlorous solution that utilizes the same phosphoric acid that your phagocytes use as part of phagocytosis and to break down pathogens. But in this water-based spray, it's 100 mils, so it's easy to travel with, but in just 15 seconds after the spray, just 15 seconds exposure time, antibacterial, antimicrobial, antifungal, antiviral, anti-spore. So I'm using this to replace the traditional alcohol wash. I'm using this without drying my hands or any surfaces, but I can also use this to spray any surfaces, particularly if I'm going into the supermarket or if there's any interaction at any essential shops or medical environment. What I also see as an essential, I finally took some time out to do some exercise the other day near the Seine River here in Paris, and I was so disappointed to see the amount of rubbish from used gloves, but also the amount of rubbish from used face masks. So since January this year, Dermapen World has been promoting the ACM Eco Gloves. The design of the Eco Gloves, by comparison to traditional latex or to traditional nitrile, these will fully biodegrade in landfill in just 6 months. If you compare that to your standard gloves using clinic, which can take decades upon decades upon decades, now I think this is an excellent way. They are in a small, medium and large size that you can purchase from Dermapen World India. And I actually encourage that you actually sell a box of these to your patients so that number one, we care for the environment. Number two, we're of course caring for our hands and caring for those around us, but we have the most eco way of delivering this as well. So when I have a look at the original Dermapen and when I have a look at the developments for Dermapen 4, what now characterizes this as the ultimate in anti-contamination management is the needle cartridge. First off, when I am performing a dermapen procedure, the first part of my ritual or the theatre of the physical procedure is to show the patient this is a brand new dermapen 4 needle cartridge. It is packaged, it is unopened, it is sterile. You will notice the date stamping, you will notice that it is sterile, and with this, you will see that this is unopened, all yours. So as part of my physical procedure, I actually make it part of the ritual to open up the needle cartridge in front of the patient. Of course, at this time, I would have gloved hands, and then I would apply the needle cartridge in front of the patient after opening it, then into the dermapen device. So they see that this is single use and this is a sterile consumable. So dermapen have further revolutionized safety from a global perspective with these cartridges. There is in fact up the top of the cartridge here a small radio frequency identification chip. It's this tiny little silver area here. That means that the needle cartridges actually have a lifespan. So this prevents practitioners globally from reusing the needle cartridge. I won't tell you what the lifespan is, but I can promise you that one needle cartridge from a dermapen 4 will be able to treat and cover the surface area of 3 to 4 A4 pieces of paper without you having to replace. So with this, it means you can treat a full face, neck, décolletage, the backs of the hands, up the arms, and even through the scalp during the procedure without any needle fatigue, without blunting or bending of the needles. So this is an exceptionally durable needle cartridge, but the design of this is single use and sterile. So following the procedure, the packaging into a garbage bin, and then the needle cartridge into a sharps bin, not to be reused. If you try to reuse it and your device isn't working, it's because the radio frequency identification chip is now identifying that the cartridge is trying to be reused. And so we now force the safety from dermapen, but now ensure and guarantee the safety for our patients globally. So with this single use, what we also have from the needle cartridge, and particularly when we've seen that there have been some recent negative news across the US for PRP combination therapies and also for sterility and safety of needle cartridges, there is a very big difference between the mechanisms of anti-contamination with dermapen 4 by comparison to just any old pen. As such, you'll notice that the needle cartridges of cheaper pens have absolutely no fluid protection guards. So as the oscillation takes place, it means that any procedural fluid, blood, combination therapies, if that's PRP, mesotherapy, contaminated fluids now physically get into the pen itself. This is a huge area of concern. What characterizes a dermapen 4 procedure, you will notice this blue area, which are 3 concertinas, including 2 fluid guards. And these actually physically prevent any procedural fluids getting into the needle cartridge itself, nor being able to get into the pen itself. So this guarantees that there is no risk of cross-contamination and absolutely no risk of any bloodborne disease transfer for this. So this becomes exceptionally important. Where the story further develops, however, is you'll notice that we have scalloped edges up the top here. So they are a scalloped effect. This means that it glides effortlessly and easily across the skin, but it prevents a vacuum. So preventing this vacuum means that procedural fluids cannot get into the cartridge, but this is also supported by these 2 breathing channels here, which are equal on both sides. So we have these multiple mechanisms, including the anti-contamination management concertina here, the silicone rings, but then also the scalloped edges in addition to the breathing channels, which now ensure the efficacy of this needle cartridge cannot create any risk. And of course, prior to treatment, you just simply remove the protective cap before beginning with the procedure. The next level of detail that I encourage you to use for every dermapen procedure, irrelevant whether you're drawing blood or not, is the role of the DP sleeve. And the DP sleeves, again, are date stamped sterile latex sleeves, and these are designed to protect the device. So of course, I would have gloved hands at this point. And the DP sleeve is a specialized sterile sheath, which is now going to cover the device. So you'll notice that there is a pointy end. Put this in an upward direction, then fit into first position onto the device, and then roll into the second position. Now, don't stop here, where I see many practitioners do. The aim is to roll it over the entire length of the device. Now, because of the light in the digital screen, it now means that you can physically see exactly the depth that you were dialing up. You can also see the speed that you are dialing up as well, so that you have an easy view throughout the physical treatment. Now, the sleeve is made out of latex. If either you or the patient has a latex allergy, not a problem. We still have perfect safety here. And the reason why is because as the needle cartridge touches the skin, the latex sleeve does not touch the skin. As the practitioner, because you will be wearing gloves, again, you don't come into direct contact with the latex within the sleeve. So this becomes the ultimate of protection. I always make this part of my ritual or theatre for the patient, for them to see the opening of the needle cartridge from the packaging, to show them the date stamping, to connect that in front of the patient, apply the sleeve, and then following the procedure, I also make it mandatory that the patient sees me remove the cartridge and the sleeve, and then that goes into a sharps bin, never to be reused. These tips and tricks ensure and guarantee your patient safety, but guarantee the branding and respect for your business, but of course the branding and respect for you as a dermapen practitioner. As part of your support network for preparation of the skin before treatments, but I view this as an exceptionally versatile product, it's the DP Dermaceuticals CliniPrep. I touched on this early. The most common agents that we see for disinfection across aesthetic medicine: alcohol. Alcohol is limited. It's antibacterial, it dries the skin out, and it's irritating. The other options, of course, are chlorhexidine solution, which can be quite reactive on many skins, but the other option also is povidone iodine solution. There's smell, but also staining issues with that. Of course, for those of you on the surgical side, or for those of you who have a fascination with all things aesthetics and surgical, you'll notice that before an operation, the chlorhexidine or the povidone iodine solution is actually left on the skin for around about 6 minutes. You can imagine that if for a traditional dermapen procedure, it only takes about 4 minutes, 5 minutes to perform a full face, it's not so effective time management if your disinfecting stage is taking 6 minutes plus in order to activate. Here comes the CliniPrep solution. So under normal circumstances, what enables a macrophage to now create the process of phagocytosis to digest and to disarm and to remove pathogens is phosphoric acid. So the CliniPrep solution is a hypochlorous solution, which is its chemical structure, of phosphoric acid. This means it's in a water base, so it can be easily tolerated. I can spray that with my eyes open, no burning or irritation. Because it's in a water base, it cannot dry the skin out. Also, you do not need to build up any tolerance to it. So with this, it can be used consistently with absolutely no problem. Likewise, also, it can be sprayed on any part of the face and body, but most importantly, 15 seconds exposure time. Whether that's onto the hands for effective cleansing after washing with soap and water, or whether it's sprayed onto the treatment area, all you simply need to do is wait 15 seconds and you have a broad spectrum antibacterial, antimicrobial, antifungal, antiviral, and anti-spore. This becomes exceptionally important because it is effective time management. It's comfortable without the drying effects, non-irritating, but also is available in a large half-litre size, which you can dispense into the spray and it still remains sterile. Alternatively, that can be also used to clean down surfaces within the business and also within the practice. As such, for me, as someone who traditionally travels a lot, the 100 ml spray is perfect to put into my cabin baggage for the plane. I use this to spray surfaces in a plane. I use this to spray surfaces at this point as I'm shopping. I use this for anything and everything as a very, very versatile product. Without irritation, it will not stain, and that can be used by yourself in clinic to prep, prime, disinfect, broad spectrum antibacterial, antimicrobial, antifungal, antiviral effect. But your patients can even use it at home, particularly for acneic conditions. It's advantageous for papulopustular rosacea, but particularly for hand washing, it becomes a key product. Another area of importance for my DermaPen procedures is to promote a sterile field. And again, another newer product produced for the anti-contamination management. However, not just exclusive for your DermaPen procedures, you can use this for any aesthetic procedure that you perform. And it's called a sterile basic dressing kit. For me, these are the ultimate distribution center for any aesthetic procedure. As you can tell by my accent, I wasn't born in France. So with this, I actually grew up in Sydney, Australia. When I was a child, every time I hurt myself, broke something, had to undergo some form of procedure at the doctor's, even if it was a vaccination, all of my doctors throughout childhood used a sterile basic dressing kit. And this is the perfect sterile distribution center for any medical procedure, from changing dressings, for your injectables, to pour your mesotherapy, and to serve as your treatment base for your DermaPen procedures. So everything contained is a sterile work environment. So we simply open up an envelope here, and this gives us, and we would open this up in conjunction with sterile gloves, but you have an exceptionally large sterile field here, of which all of your products are going to sit in the center here. So again, this serves as part of your ritual and as part of your theatre for a DermaPen procedure to guarantee and to ensure the ultimate of safety, so that your colleagues see this, but so that your patient sees this. When we remove the plastic, you'll see that what features is a dressing tray. Inside the dressing tray here, you can actually hold your syringes over the top. They can sit into place. You can use your DP Dermaceuticals Mesoglides, your CliniPrep solution into one channel, and then your Uber Pro Peel into the other. So you can allocate what you want to put into the sterile channels here. To further support your procedures, there is a soft paper napkin. I like to use this to tuck in around the patient's neck or any clothes, depending on where you are sitting. There are 2 pieces of soft gauze. This is particular benefit because it's not hard or rough gauze for removing post-operative residue, but you also have 5 cotton balls here. So all of this can be easily distributed via the 3 sets of forceps that are contained within the full kit. So for me, this is the ultimate distribution center, not just for DermaPen, but for every injectable procedure, for any change of wound dressing, and for the basis of any procedure that you're currently offering with your patient. Now, to try and work to protect the environment as much as possible, for your non-sterile gloves, I recommend the DermaPen World Eco Gloves. So the Eco Gloves are biodegradable in just 6 months in landfill. By comparison to traditional nitrile, by comparison to traditional latex, which can take decades upon decades before they will physically break down, the advantage of the Eco Gloves, particularly when we are going through so many gloves from what we're wearing day to day for protection during the corona times, but also because as medical practitioners, we are changing our gloves 20, 30, 40 times a day. Why not do this with the environment at the back of our minds? And this is where the eco gloves become advantageous. The eco gloves come in 3 sizes. These are non-sterile gloves, so these would be the perfect substitute for the examination gloves that you are currently using and deliver efficacy, but most importantly, support the environment at the same time as well. For the physical dermapen procedures, and of course for any semi-surgical procedures that you are currently performing, of course you will still require some sterile gloves. And the sterile gloves will now promote the perfect support system for all of your dermapen, but for all of your aesthetic procedures. So you really see what highlights a dermapen procedure above and beyond just any microneedling procedure is the ultimate duty to safety, the ultimate commitment to practitioner, patient health, but of course, as a dermapen practitioner, to the health of your business, your practice, and to the health of your branding as well. Where I take this further is the anti-contamination protection mask. I'm commonly filmed in these when I am performing a treatment. So this visor mask is essentially a spit guard. So the elastic, it sits just underneath the chin, and then the elastic's behind the ear. You'll notice if I go side profile here, that the mask does not cover my nose, and the mask is not fully covering the mouth. So this is not an enclosed mask. So this is not ideal for you to go into public, particularly during corona times. This is not the same type of mask. But during your procedure, particularly if you're talking, this will prevent any spittle, but what this also does will protect any breath from getting physically onto the patient. However, once you're outside during corona times, I still suggest that you continue with a normal mask, but otherwise for your dermapen procedures, perfect. These can be used multiple times. You can just simply wash down with a small amount of Clinic Prep solution and you have the ultimate salve. Particularly if you're talking, it's easier for the patient to see your mouth and to be able to lip read you and to understand you as well. So with this, what supports all of our dermapen procedures is now promoting the ultimate of sterile and aseptic preparations and mesotherapy. So the classic DP dermaceuticals, particularly the Hyla Active, which is your non-negotiable as your procedural glide and medium to facilitate movement, ease and comfort. These products are available in a 30 ml, but now also feature in a 50 ml and then a 250 ml airless aseptic pump. This means that you can administrate with your dermapen procedure for the lowest possible price. The packaging is a specialized aseptic airless pump. And with this, what features within the formula is ethyl hexyl glycerin as a conservation agent. So in fact, the formula is so pure and so safe for conservation that I can eat it. This becomes the most cost-effective way, particularly as you mix and blend with other DP dermaceuticals, also utilizing the same type of preservation system. But soon, once couriers and once our warehouses are back up and running, there is the brand new MG collection. And the brand new MG collection are 5 milliliter sterile single-use vials. With these, the design of the vials, I see ingenuity here, particularly because we have so many options. We can mix and match to customize your mesotherapy, but also you can use the nipple applicator, which will simply release the solution onto the skin topically, particularly if you're wishing to use the whole solution, but otherwise it connects in with a Lua lock syringe, which now means you can custom blend the solutions, ensuring full sterile working environment. And again, this becomes part of the ritual and the theatre that I perform in front of the patient. So they see my attention to detail of me putting on fresh gloves. They see me sharing with them the opening of the Dermapen 4 needle cartridge. I encourage patients to always watch, check and ask, and to make sure that they see that cartridge being opened in front of them. I show the patient the sleeve and I talk about what characterizes the original trusted Australian, the original inventor of automated microneedling, Dermapen. What characterizes these procedures is the utmost attention to detail and duty for comfort, safety, but also for hygiene. So this becomes an effective protocol which now builds confidence, but an effective protocol which now guarantees your level of safety. But why just restrict it to Dermapen when you can use many of these products for so many of your other aesthetic procedures, but also particularly for home care with the Eco Gloves and also with the CliniPrep, intense flexibility. I wanted to finish up with just sharing some really easy, simple hand washing tips that I share with patients. First, either using soap or using a hand wash gel, you need to be washing your hands for at least 25 seconds. So not just putting your hands under cold water, you need the soap or the gel to physically defat any grease onto the hands. So you want to focus onto the palms of the hands, then moving onto the fingers themselves. Now work onto the backs of the hands. From the backs of the hands, working in between the knuckles, but then in between the fingers and the webbing on both hands. Cleaning of the fingers, lower, upper, and around the nails, the thumbs, and then the wrists. Following this, pat dry the hands. It's preferable with paper towel as opposed to a fabric towel. And then a quick spritz of the CliniPrep solution. Massage that through. 15 seconds exposure time. Broad spectrum antibacterial, antimicrobial, antifungal, antiviral effect without the dryness or the irritation. For those patients who are currently affected by a little bit of atopic dermatitis on their hands, I recommend a small amount of the DP Dermaceuticals skin veneer. You quite literally need just a quarter of a pump of product to add back intense hydration, but otherwise produced by the Hyla Active sculptured mask range, there is also a hand mask which will easily fit around both hands and will provide a saturation and inundation of a triple molecular weight of hyaluronic acid, zinc, sodium, manganese, iron, and copper ferments to now relieve atopic dermatitis, the dryness, the irritation, and the chafing from over hand washing as well. What I also advise, particularly from a glove perspective for patients, is to understand that if you go outside with bare hands and you start touching everything, you need to wash your hands. You need to re-disinfect. It's absolutely no difference with gloves. So too common, every day I'm seeing patients who are wearing the same pair of gloves every single day, and then they take those gloves off and maybe they wear them the next day as well. These gloves can become just as contaminated as what your hand is. So again, why not encourage patients to purchase some CliniPrep solution, and then they can spray the gloves themselves, particularly if they are out, but for every interaction, whether that is taking money, whether that is touching something in the supermarket, in the pharmacy, or touching something outside, surfaces, doors, whatever that's going to be, either re-glove as you would in clinic. So I recommend a box of the Eco Gloves, the most environmentally safe way to protect ourselves, or otherwise use the CliniPrep solution so that you can spray the gloves and follow a hand cleansing ritual at the same time. These rituals really serve not only to protect you as the practitioner, but most importantly during these times, it highlights your attention to detail. And it's for this reason that a dermapen treatment creates theatre of safety, but now demonstrates to the patient that we are delivering to you the safest, most hygienic procedure possible, because we care about ourselves as dermapen practitioners, we care about you and your family as patients, we care about our practice and our clinic, and we care about our branding and our name. Safety first, first do no harm, and now delivering the best of duty of care and treatment efficacy, combining in the anti-contamination management system with dermapen and DP Dermaceuticals. That concludes the formal part of my webinar for today. And we've had a slight delay just due to a lag with the show from the video. So this means that some of the questions are coming in a little bit slowly. But one question that has just come through is, can I use the CliniPrep anywhere on the body? Yes. So even as a preparation before alopecia procedures, particularly if you're going to incorporate PRP with dermapen, I find the spray is very easy to separate the hair and simply spray that through. So the CliniPrep is very easy to work with. For me, it's a water base. It's got a slight swimming pool fragrance to it, but it doesn't contain bleach. It won't stain the clothes, and exceptionally versatile. So I actually clean surfaces with it. Remember just to leave it for 15 seconds in order to activate its absolute full effect. Another question that comes through with the anti-contamination sterile basic dressing kits, these are single use. So all of the consumables contained within these, once you have completed your procedure, then you would put the physical kit and anything that has any biohazard liquids into a biohazard bin, and then you would dispose of your needle or needle cartridges into an appropriate sharps bin. So this serves as an effective overall safety for the clinic, but also effective disposal as well. That concludes our questions, and that also concludes the formal part of the webinar. We have been creating the ultimate next series of topics for you, which are going to include treatment of hyperpigmentation, treatment of acne, active acne with dermapen, but also treatment of post-acne scars. We will keep you posted on social media as to the next range of topics, and we're going to continue on live to my lounge here in Paris, so long as both of us are in lockdown. So we look forward to hearing about any innovations with topic. I'm Dr. Andrew Christie. A huge thank you from myself here in France. A personal thank you to our phenomenal team of producers and moderators on my screen behind the scenes, to Omang, to Hugo, and to Pete. A huge thank you to all of you from Dermapen World and Dermapen World India. And now I'm going to hand you back over to Mr. Umang Bambri to conclude today's session. Thank you so much. I cannot wait to catch up. Same bat time, same bat channel next week.
Thank you, Andrew. It's been lovely hearing you again, and we look forward to our audience joining us same time next week on the special web series where we start to share the key protocols of dermapen treatments, which would cover during in-treatment protocols and even post-op protocols for a patient. So the topic for next webinar would be treatment for acne with dermapen and DP Dermaceuticals. Thank you. Look forward for all to joining us. Bye-bye.